Hello, this is Dr. Eldred Taylor, co-founder of the American Functional Medicine Association. In anticipation of our March 2014 meeting, we would like for you to get to know our faculty and preview what they will be speaking about at our first American Functional Medicine Conference. Dr. Nathan Goodyear is the founder, co-owner, and lead physician at Seasons in Farragut, Tennessee. His passion for wellness began with his own 100-pound post-football career weight loss. He is dedicated to health and wellness through a solution-based functional medicine approach grounded in science. Dr. Goodyear's first book, Man Boob Nation, an integrative medicine approach to low testosterone, is set for publication in the next 6 to 8 weeks. Dr. Goodyear received his Bachelor of Arts from Louisiana Tech University in Ruston, Louisiana, and Doctor of Medicine from LSU Health Sciences Center in Shreveport, Louisiana. He is board certified in obstetrics and gynecology and is a fellowship-trained metabolic specialist, anti-aging, and regenerative medicine. He was the chief resident in obstetrics and gynecology at the University of Tennessee in Knoxville. Dr. Goodyear has a wonderful wife of 23 years. They have been blessed with 4 wonderful children. Dr. Goodyear and his family currently reside in Farragut, Tennessee. Dr. Goodyear, we're happy to have you tonight.
I think it's important to understand where we came from. As you referenced, in San Antonio 7 years ago, I was sitting in that conference room and you were talking about bioidentical hormones. And you said, I'm an OBGYN. I'm a recovering OBGYN. And you touched something with me because I knew where I was in my clinical and professional career. I was at a crossroads. And so just from the perspective of training, there was that connection. But that was 7 years ago. And when you talked about the caterpillar line and getting out of line, and basically, once I got out of that line, it's been a basically whirlwind ever since. And the practice and the way I practice and the knowledge and the true health and wellness that I'm able to help patients achieve, it really has as a foundation that meeting and that contact I have with you. So I think you deserve a lot of credit there. And you and I have talked a lot about that over the last many years. But basically, what I'm talking about is testosterone. Now, I'm a recovering OBGYN. So a lot of people would go, well, what do you know about testosterone in men? Well, back when I started seeing men, I didn't know anything. And so I had to look to the experts to give me guidance about testosterone. And what I found is that most of the guidance was based around opinion. Now, I wanted to start the process of researching the science behind this. And so a lot of the science actually didn't back up a lot of the expert opinion, whether it was NDM or whether it was just a panel form. It did match up. So I set forth on about a year and a half, 2-year project to just research the science behind low testosterone. And what I started to discover was that low testosterone as it relates to men is an enormous problem. It's a huge problem, and there's no pun intended there, but this problem is a growing problem, and it's a problem that is accelerating at ever increasing levels, even at younger levels. There was a study done in 2006 where they looked at men across the country, and they found that all levels from 1987 to 2004, testosterone levels have decreased by about 15% at every age group. And so this is a significant issue that we continue to see in our men today, especially in America. But my journey in the research over 2 years really led me to discover that the way most are treating low testosterone is not really founded in the science. It's founded in marketing-based medicine. And so I set out to write this book. It's called Man Boob Nation. You got to have a catchy title. And the title actually came when we were down at Disney World a few years ago. And my, at the time, 6-year-old daughter told me, Daddy, they need to put a topless sign here at this water park. at Disney World. And I said, why, sweetie? And she said, you see that man right there? He's got man boobs. And so that's my title. I was like, that's perfect. That's perfect. But the man boobs is basically just a catch title, but it's pointing at the physiologic manifestation of the underlying biochemical causes, which low testosterone is really the effect, it's not the cause. When you look at the causes, what I was able to identify through research, and there's many more, but the major points would be things such as natural decline, though I would propose that a lot of that's not natural, stress, estrogen, obesity, inflammation, toxins, medications, and hormone replacement therapy. So really the book and then the talk is born out of what would a functional medicine doctor do in a solutions-based strategy to help manage low testosterone. And Eldred, that's really where it all came out. And it really all started back when I heard you talk about getting out of line. And that's really where it all started. And here I am as an OBGYN, basically in the book and talking about low testosterone.